HighBridge, a division of Recorded Books, presents Coping with Infertility, Miscarriage, and Neonatal Loss, Finding Perspective and Creating Meaning, by Amy Wenzel, Ph.D. Read by Coleen Marlo. Introduction. Perhaps the most dreaded nightmare for adults of childbearing age is a pregnancy loss. Pregnancy loss can create profound feelings of despair in expectant parents, regardless of whether the loss occurs earlier in pregnancy, that is, miscarriage, later in pregnancy, that is, neonatal loss, or in the short period of time after a baby is born. In many instances, the same set of emotions occurs when a couple learns that their fertility treatments were unsuccessful. Doctors Janet Jaffe and Martha Diamond, two expert psychologists who specialize in perinatal psychology, referred to this collective grouping of reproductive events as reproductive trauma. I also referred to this collective grouping of events as reproductive loss, because in all instances, one experiences the loss of a greatly anticipated addition to the family that was expected to add a layer of meaning in life, perhaps like no other event could do. Throughout the book, I use the terms reproductive loss, pregnancy loss, and reproductive trauma interchangeably. Many people who have experienced reproductive loss observe that there are few established rituals in today's society for grieving such events, in contrast to the rituals for grieving the loss of a parent, spouse, or a close family member. They find that however well-intentioned a sympathetic comment or word of comfort, it usually seems like the wrong thing. Furthermore, they are bombarded by constant media reports of celebrities who recently gave birth, who are pregnant, and who are expanding their families through expensive means that most people can only dream about. When they go grocery shopping, it seems like everyone else in the store is pushing an adorable little baby or toddler in the shopping cart. In the meantime, they are left to cope with an excruciating sense of emptiness. I know because I've been there. As a clinical psychologist who specializes in perinatal psychology, I have worked with countless women who have experienced pregnancy losses and other reproductive traumas. More important for the purpose of this book, I experienced my own series of reproductive losses. At 21 weeks gestation into my first pregnancy at age 37, I lost my son due to premature rupture of membranes. On another occasion, I was technically pregnant for a week or so, but my human chorionic gonadotropin levels didn't rise like they should have. And I went through time-consuming and unsuccessful fertility treatments. How does one cope with these excruciatingly difficult life events? Therapy is certainly an option and can provide a great deal of comfort. However, I do not want to imply that there is something pathological about grieving the loss of an unborn child and that professional intervention is absolutely essential. In fact, I would caution people who have experienced reproductive loss to choose their therapist carefully, as professional training in a mental health discipline does not guarantee that the provider possesses the knowledge and sensitivity needed to work with the fallout from this life event. Another option to which people who have experienced reproductive loss often turn is books that they expect will help them to understand their emotions, normalize their experiences, and feel a part of a broader community of people who have experienced similar losses. Unfortunately, my own experience and the experiences of many of my clients were that reading many of the books on the market, quite simply, made us feel worse. It's not that these books lacked sensitivity and compassion. Without fail, they were exquisitely sensitive and compassionate. The issue was that although we expected to gain comfort from stories of people who had also experienced a reproductive loss, it turned out that the last thing we needed was to read tearjerkers about a subject so close to home. In addition, we inevitably compared ourselves to the people described in these books. If a woman highlighted in a case description experienced multiple pregnancy losses, Those of us who experienced only one loss would ruminate over the likelihood that we would have another one, concluding that it was certain that we would experience a subsequent loss. If a woman highlighted in a case description experienced a loss subsequent to having a healthy baby, those of us who had no children found ourselves feeling resentful and wondering how this situation could possibly apply to us. At least this woman had a child. Even when a case description matched up remarkably well to our own circumstances, we could always find nuances that made us view our own situations as far more hopeless and tenuous than theirs. For example, yes, but I'm over 40 and she was only 35. Moreover, the focus on these case descriptions in many of these books left little room for discussion of actual strategies for coping with and healing from the loss. I and others had similar reactions. Just tell us what to do. Just tell us how we can begin to make sense of this, work through this, and though we might not be the same again, develop a sense of clarity, peace, and optimism for the future. We realized that there is no one-size-fits-all approach, but we wanted something. In my own situation, I found that my training in evidence-based approaches to psychotherapy, particularly cognitive behavioral therapy, CBT, was a tremendous asset in helping me cope with my loss and my uncertainty about the future. The basic premise underlying CBT is that the meanings that we attribute to our life experiences, as well as the behaviors in which we engage in order to cope and live a quality life, have a profound effect on our mood. These attributions and behaviors also influence the likelihood of developing or experiencing a recurrence of a mood or anxiety disorder. In other words, how we think about the loss and what we do about it plays a large role in how we cope, achieve acceptance, and eventually adapt. Cognitive behavioral therapists use a number of active strategies to identify, evaluate, and modify unhelpful thoughts and attributions, strategies to engage in adaptive behaviors in the face of life stress, and strategies to attain acceptance and centeredness. My clients and I found that the gradual, empathetic, and compassionate application of these strategies gave us tangible skills for dealing with the loss that we could not find in most other books on the market. We found that applying these strategies in our daily lives helped us to break out of the cycle of sadness and rumination and gain perspective on and acceptance of the loss. As I was recovering from my second trimester loss, I continually reflected on my good fortune of being a cognitive behavioral therapist, because I relied on the tried and true mood management strategies on which I had been coaching my own clients for years. I honestly believe that I would have been paralyzed with grief, numbness, and lack of acceptance for a much longer period of time than I was without the active application of these strategies. Thus, my purpose in contributing yet another book on reproductive loss to the market is to describe the specific tools that my clients and I have used to cope with pregnancy loss, infertility, and other circumstances related to a reproductive loss or trauma. It addresses what I see as such a gap in the writing on this topic. How specifically does one cope, find perspective, create meaning, achieve acceptance, and take care of oneself after such a devastating event for which there exist few supports and resources? The tools described in this book have been evaluated by research examining cognitive behavioral treatment packages, which have been shown to be efficacious relative to not using any coping tools at all, or to non-specific approaches to treatment such as supportive psychotherapy. Throughout the book, I describe specific ways to adapt these techniques on the basis of my own experience and my experience in helping my clients implement them in their lives. Here's a snapshot of what you will learn in this book. In Chapter 1, you will learn about the grieving process. You will learn that it is okay to be feeling, thinking, and doing as you are, even if others are strongly encouraging you to move on, and even if the way you are feeling, thinking, and doing is very uncharacteristic of you. In Chapter 2, you will learn about tools that can help you get by in the first weeks following a reproductive loss. Some of these tools are not necessarily long-term solutions for helping you make decisions and enhance your quality of life, but they will help you survive the moments filled with pain and emptiness. In Chapter 3, you will learn about ways to reconnect and become actively engaged in your life in a meaningful, valued way, even when you don't feel like doing so. We know that active engagement in activities that are consistent with your values, strengths, and interests serves as a strong buffer against depression and other negative emotional experiences. Inactivity and isolation are more than understandable after a reproductive loss or trauma. But after a period of time, they will unequivocally make things worse. In Chapter 4, you will learn how to cope with and manage disturbing thoughts and images of the pregnancy or unsuccessful infertility treatments and their immediate implications. Specifically, you will learn to identify when these thoughts and images are activated, obtain some distance from them, and reevaluate them so you are viewing these experiences in a balanced manner, as accurately and helpfully as possible. You will also be introduced to a strategy to address thoughts and images that you experience as intrusive. These thoughts and images do not have to hang over you like a black cloud or color the way you view other events in your life. In Chapter 5, you will apply the tools that you learned in Chapter 4 to cope with disturbing thoughts and images of the longer-term future. You will also learn tools for accepting and coping with the uncertainty of your reproductive future. Difficulty coping with uncertainty is a key contributor to anxiety, apprehension, and stress, and developing this skill will help you to manage the curveballs that life throws for many years to come. In Chapter 6, you will learn tools for interacting with others in a variety of circumstances that are difficult after a reproductive loss. How do you share the news of the loss with other family members? How do you maintain a fulfilling relationship with a pregnant friend who seemed to have conceived so easily? How do you respond to well-meaning people who unintentionally make unhelpful or insensitive comments? How do you connect with a spouse or a partner who is handling the event much differently than you are? Chapter 6 addresses these and other circumstances. Chapter 7 was written for people who find themselves to be especially avoidant of reminders of their loss, such as situations in which they might encounter women who are pregnant or families who have small children. This chapter outlines a step-by-step procedure for overcoming this avoidance. In Chapter 8, you will learn tools that will help you make sound, informed decisions about your reproductive future. You will also learn that it is okay to ultimately choose solutions that on the surface are associated with many disadvantages in order to achieve your most valued outcomes. In Chapter 9, you will learn tools for achieving a present-focused, non-judgmental mind, a process called mindfulness. Mindfulness allows you to form a new relationship with your emotional pain, and even with any physical pain you might be experiencing, such that the pain becomes less adversarial and threatening. The practice of mindfulness helps people to accept their life circumstances and let go of struggles that they cannot change. This chapter will give you ideas for integrating mindfulness into the manner in which you live your life. In Chapter 10, you will work toward finding meaning from the tragedy of your reproductive loss. You will create what I like to call a new normal. This chapter will help you pull together the material and tools described throughout the book for you to gain wisdom and growth from your experience and to create a life well lived, regardless of your reproductive outcome. The most important lesson that I've learned from my own and my clients' experiences is that every reproductive loss is different. Although the woman's age, the length of gestation, history of previous pregnancy losses, and the amount of time and money devoted to conceiving are important variables, the key is the meaning that the person attaches to the pregnancy. Generally speaking, the more psychological and emotional investment a person places in the pregnancy, the more difficult will be the experience of loss or trauma. This is coupled with the fact that we all have our own history and even baggage, such as the early loss of one of our own parents, scars from past childhood sexual abuse, or the expectation that we could have it all and establish a career before embarking on family planning. All of these historical, psychological, emotional, and situational factors contribute to what Drs. Jaffe and Diamond referred to as the reproductive story, which is the vision that we have created about our transition to parenthood and subsequent family composition. The unique experience of a reproductive loss, then, is intricately tied to your reproductive story. Reproductive loss disrupts your reproductive story and forces you to confront the possibility that your desired story will not be realized. This experience is different for everyone because everyone's reproductive loss and reproductive stories are unique. What this means is that not all of the material covered in this book will be right for you. There might even be times that you think to yourself, how can she be suggesting this? This will just make me feel worse. Keep in mind that you are the expert on your own tendencies, preferences, history, and reproductive story. And all things being equal, I fully recognize that readers already know how to take care of themselves. The issue at hand, however, is that all things are not equal at the moment. The reader will have likely experienced a devastating reproductive loss or trauma, and many of her adaptive coping and self-care skills may have gone out the window. It is my hope that this book can serve as a concrete resource for people who have experienced reproductive loss to consult when they can't imagine or can't remember how to take care of themselves and make sense of their recent life events. When you do identify one or more tools that might be a good match for you, my suggestion is to keep an open mind and systematically practice them for a good chunk of time, that is, a few weeks at least. I say this because learning most of these tools is akin to acquiring skills such as riding a bicycle. They are not perfected in one instance. In fact, people often find that when they first try to apply the tools during a time of acute emotional distress, they are disappointed that they do not feel better. The reason for this is that it is difficult to learn and perfect a tool in times of emotional distress. Your attention is divided, your mind is elsewhere, and you are experiencing overwhelming emotions. Thus, it is often best to practice the tools in times of relative calm so that you develop skillfulness in their application and can later apply them to acute emotional distress. I have a couple of caveats pertaining to things that I have deliberately chosen not to include in this book. The purpose of this book is not to be a comprehensive resource on understanding every facet of pregnancy loss or reproductive trauma. I provide few statistics because although they might instill hope that people who have experienced reproductive loss are not alone, more often they also instill a great deal of fear and apprehension about future pregnancies. Rather, this book is meant to be a source of tangible suggestions for coping and building a meaningful life in the wake of the tragedy, providing wisdom, inspiration, and hope. It will not provide detailed steps on ways to handle every facet of post-loss challenges, but it will give you a framework for gaining perspective and taking care of yourself. In addition, although at times I illustrate the application of these cognitive behavioral tools using case examples, the details of the actual loss in each example are kept to a minimum. In most cases, I also do not include reference to the individual's age, whether the individual has other children, or whether the individual went on to have a successful pregnancy. Instead, the case examples focus on the manner in which people who have experienced reproductive loss use their strengths and resources in their lives to manage their grief, build meaning in their lives, and take care of themselves. Inclusion of details such as the individual's age, family composition, and ultimate reproductive outcome invariably facilitates unhelpful comparisons. This is just too hard for people who have no children and who are unsure of whether there is a child in their future, for people who have one child and who desperately want more but who are having trouble conceiving, and for people who have 2 or more children but who anticipate that they will feel unfulfilled until they have another child. Before closing this introduction, I'd like to say that this book is appropriate for both women and men. Too often, men's experiences of pregnancy loss and infertility, or even pregnancy in general, go unacknowledged. The reproductive story can be every bit as meaningful to men as it is to women. For this reason, in many instances, I refer to people and individuals rather than to women per se. At times, however, I was forced to include a pronoun, and in these instances, I chose she to avoid clunkiness in the writing. However, I want my male readers to know that the material in most sentences that reference she can apply to them as well. Woman or man, one does not necessarily get over a reproductive loss. It changes who you are. It alters your sense of safety, predictability, and even justice. And it reminds you that life is far from easy. But you can cope effectively, and with time, you will be able to achieve acceptance, create meaning from the experience, and take care of yourself. Even if your reproductive story ultimately turns out very differently from how you had hoped, you will be able to live your life according to your values and strengths and gain lasting fulfillment. This book describes many well-established strategies for doing so, tailored, of course, to the unique experience of reproductive loss. As time passes after the initial event, some days will be better than others. Your reaction to this book might even be different at different times. Sometimes you may find it hopeful and inspiring. Other times you may find it depressing. As you will see, a vast array of emotional experiences and reactions are to be expected following a reproductive loss. My hope is that you will find something in this book to help soften, but also to help you accept each of these emotional experiences. It is my privilege to go along with you on your journey to healing, self-care, and personal growth. Chapter 1. Normalizing Emotional Experiences. There is no doubt that the fallout from a reproductive loss is brutal. If you required medical treatment at a hospital, it is excruciating to leave without your baby. If you were far enough along to feel movement and your baby kicking, the emptiness in your womb that follows can seem unbearable. If you had been trying to get pregnant for much longer than you had expected, the heartache can be gut-wrenching. Regardless of the specific circumstances surrounding your reproductive loss, you are experiencing the loss of an important dream that is central to your identity as a person who hopes to start or expand your family. As devastating as it is, know that the first several weeks following the loss or trauma are the absolute worst. It does get better, slowly over time. You will not stay in this limbo forever, even though at the moment it feels like you will. In this chapter, I describe the myriad emotions that you might be experiencing during this difficult period of your life, as well as some thoughts that go with those emotions and ways you might be handling those emotions and thoughts. The point of outlining these for you is to communicate that what you are experiencing is to be expected, however intense or out of character it feels. Emotional experiences in the first weeks. There are no right or wrong emotions to feel during this time. Everyone is different. In fact, it is quite possible that you will find yourself experiencing a variety of emotions at once, or moving quickly from one intense emotional state to a completely different but equally intense one. During the first weeks following a reproductive loss, it might seem like your emotions are on a roller coaster and that you can't imagine you will ever feel normal again. These emotional experiences are compounded by physiological changes you may be experiencing. If you are taking fertility medications, many of your hormone levels are out of whack. If you experienced a first trimester miscarriage, not only will your hormone levels be shifting back to baseline, but you might also be experiencing bleeding, cramping, and possible infection. If you had an incomplete miscarriage, you might be waiting to see whether you need surgical intervention. The further along you were in your pregnancy, the more likely it is that you are producing breast milk, a cruel reminder of the loss that you have experienced. Other physical symptoms you may be experiencing include anemia, night sweats, and hearing your pulse in your ear. Although the precise manner in which these physiological changes affect emotional experiences is unclear, the end result is that you are not feeling well physically, which can further sap the psychological resources that you would normally use to cope with adversity. In the following sections, I describe some of the emotions that you may be experiencing in the first weeks following your reproductive loss. Numbness. Many people who have experienced a reproductive loss report feeling numb at first, as if they can't feel anything. If you had a procedure in a hospital, it might have seemed like a whirlwind, leaving little time to acknowledge or experience emotions, let alone make sense of them. Those feelings of numbness and unreality can persist for several days after you have returned home. It might seem as if the possibility of ever experiencing joy and happiness again is non-existent. Trust me, it just seems that way. You will feel joy and happiness again, although it might not be for some time. Also, some of the joy and happiness might take on new meaning. Disbelief. Other people who have experienced a reproductive loss report a sense of disbelief. Did that just happen? It might seem like one moment you were pregnant and planning for a new addition to the family, and the next minute you were left with nothing. It can also be difficult to comprehend an entirely new view of one's reproductive health. For example, many women who have experienced a pregnancy loss will be considered at risk in future pregnancies and will receive additional monitoring and intervention. They may have never entertained the notion that they would be regarded as at risk in pregnancy. In the first weeks following a pregnancy loss, it is often difficult to accept that childbearing might always be different and more difficult for you than it is for women at low risk. Your new reality might be quite different from the reproductive story that you had envisioned for yourself. Profound sadness. There are usually a lot of tears in the first weeks following a reproductive loss. Many people describe a profound sadness unlike anything they have ever experienced before. This sadness might even be accompanied by a sense of hopelessness about the future, lack of interest in your routine and activities that you used to enjoy, sleep disturbance, either sleeping fitfully or sleeping too much, appetite disturbance, either having little appetite or overeating, fatigue, and difficulty concentrating. Reproductive loss can really hit a person's self-esteem, even to the point at which you might experience a sense of worthlessness. Some women recall a profound sense of inadequacy following a reproductive loss. After all, if I can't even do something that it seems like all other women can do, have a child, what good am I? Men can have the same reaction, especially if they are struggling with male infertility. Other people report pervasive excessive guilt over the fact that they could not do anything to save the unborn child. Still, others believe that the reproductive loss is a punishment for past transgressions. At times, it might seem like life is not worth living. All of the experiences that I described in the previous paragraph are those that can contribute to a diagnosis of depression. Major depression, to be exact. However, I want to be clear that grieving a substantial loss, such as a pregnancy loss, is absolutely normal and in no way means that you have a disorder. It also does not mean that you absolutely must receive professional mental health services. In fact, much of the material that I include in this book will help you to process the loss and heal on your own. In the final section of this chapter, I provide some guidelines for determining when consultation with a mental health professional is warranted. Guilt. Although I mentioned guilt previously in the section on sadness, it is worth noting that guilt can take on a life of its own following a reproductive loss. As stated previously, many women feel significant guilt that they were unable to save or otherwise take care of their baby. If you were under anesthesia when the fetus was removed, you might feel guilt that you were not present for the moments when your baby was alive. Women often feel guilt associated with their belief that they have failed to give their partner a child. Men often feel guilt associated with their belief that they should do more to help their partner and their child. People who have experienced reproductive loss and trauma often fixate on the idea that the loss is somehow their fault or that they should have done more to prevent it. The tools described in this book will help.
Sample complete. Ready to continue?